Is Asian double eyelid surgery worth the risk factors? How likely am I to get unideal results or face risks, such as a muscle getting damaged, not being able to close my eyes after surgery, crease too high, etc., if I go to a board-certified and experienced doctor? I understand asymmetry is common and would be okay with minor asymmetry.
Thank you for your question. You're asking a question about the possibility of having suboptimal or complications related to Asian eyelid surgery when you describe possible muscle damage or difficulty with eye closure, and then you're asking about board-certified doctors and experience. So certainly to help, I can help you with this question. I'm a board-certified cosmetic surgeon, certified by the American Board of Cosmetic Surgery, and a fellowship-trained oculofacial plastic and reconstructive surgeon, trained under the auspices of the American Society of Ophthalmic Plastic and Reconstructive Surgery. This is a specialty after eye surgery of complex and cosmetic surgery of the eyelids, orbit, and lacrimal system. I specialize in Asian eyelid surgery as a big, significant part of my practice, both primary and revision. So when I have this discussion with my patients who are considering Asian eyelid surgery, I do stress that Asian eyelid surgery does require a certain level of experience to understand a lot of the nuances associated with performing this type of surgery. Board certification, just for clarification, is a very is somewhat deceptive in the way it is represented by different doctors for a variety of reasons. Much of which has to do with turf wars and competitive advantage using a term which doesn't necessarily have a direct reflection on an individual doctor's experience and talent. So when we look at what a doctor does, whatever specialty their background is in, you always want to see how familiar are they with Asian eyelid surgery. If you go to somebody who has done it a lot, does it a lot, is familiar with the different methods, both non-incisional, incisional, is very comfortable with the terminology of nasally tapered crease, parallel crease, laterally flared, epicantoplasty. I mean, these are terms that someone who performs Asian eyelid surgery is familiar with and has experience with, and of course can show you examples of their work with before and after photos. You mentioned clearly that you understand that a subtle asymmetry is possible, and that is something that we do also explain to our patients, that yes, the goal is to be as symmetric as possible. And prior to surgery, I spend a lot of time with my patients doing the drawing and doing the planning and measuring to optimize the procedure's predictability. Sometimes you need to do enhancements, but that's part of the surgery. So I think that when you are looking for a doctor to perform your surgery, it is very important that you be comfortable with that doctor. When you meet with this doctor and you have a consultation, the doctor, what I do is I like to spend a lot of time with my patients. I like to understand what they're looking for. Sometimes they want something I cannot deliver, and then I won't do their procedure. But it takes time to understand that. So having a thorough consultation and feeling comfortable with the doctor's technical skills. A lot of times it's also a good idea, and I think it's a really good way to measure confidence, is just get the feeling from the staff. The office staff of a doctor's office is familiar with what types of patients are typically seen by the doctor and what they do regularly and what their results are like. So if you feel like the staff feels comfortable and confident and enthusiastic about that doctor's skills with Asian eyelid surgery, then your chances are you're in the right, you're on the right path. So as far as board certification is concerned, yes, doctors who are properly trained in a cosmetic surgical specialty has some kind of board certification, but it can be board certification from the American Board of Cosmetic Surgery, the American Board of Plastic Surgery. They can be fellowship trained through the American Society of Ophthalmic Plastic Surgery, the American Academy of Facial Plastic Surgery. There are numerous specialties that do perform cosmetic surgery, and it's not a specialty that has a dominance, but it's actually the individual doctors. We're all individuals, and the things we do that we like to do, things we don't like to do, and that is something that you can definitely get a feel for when you do your consultation. In experienced hands, complications that are significant, such as difficulty with eye closure or problems with muscle function, are relatively unlikely. They can always happen, but you are always thinking about probabilities. And when you meet with the doctor and you get a sense of that, you'll probably feel comfortable and confident with someone, and then once you have that relationship established, move forward. So I hope that was helpful. I wish you the best of luck. Thank you for your question.